Good afternoon. I want to welcome each and every one of you to my congressional hearing, or briefing rather, entitled Healthcare from 30,000 Feet, the Past, Present, and Future from an Industry Perspective. And I want to recognize Ranking Member Pallone, who I'm told is on his way. When he arrives, we're going to allow him to offer a few remarks. I especially want to thank our moderator and all the panelists who joined us from different corners of the healthcare arena to discuss these topics and to provide us with their informed perspective. And I want to thank all of the audience members for joining me this morning for this most important discussion on the state of healthcare in our nation. I want to just say that my staff member who wrote these remarks has shown a tremendous amount of optimism, because these remarks were written for a packed room, but they are appropriate anyhow. Because the people who are here because you want to be here and you want to underline what I believe is the most important issue that we can confront as policy holders, and that is the health care of our nation and our citizens. Some people, as a matter of fact, the vast majority of us have or will come in contact with the healthcare delivery system. I didn't realize that, but one of the keys to wisdom, or as some would say, the keys to getting old, one of the marks of getting old is that you are a frequent associate and visitor to someone from the healthcare profession. And one of the signs of a well-ordered and esteemed and sustained marriages is when you and your spouse, after years of wedded bliss, you find yourself sitting in the living room in front of the TV. You're at one end, your spouse is at the other end of the couch. And invariably your conversation goes to this point. Did you take your medications for the day? I can say that that's a sign of wisdom and age and long marriage. I just want to, again, just repeat that I am so delighted to have you here today. As our healthcare discussion moves forward around the country, be it here on Capitol Hill or in corporate boardrooms, townhouse forums, beauty shops, barber shops, around the kitchen table, it's important that we remember that the origins and recent history of the American healthcare system, the current state of affairs, and how these realities guide the future of care in our country. And again, I want to underline the fact that I am so happy to have such esteemed panelists from across the nation, from across the healthcare industry, to participate in this panel. It shows commitment to this important American concern and that's the concern for our overall health care and our health care delivery system. I want to recognize and bring to you now someone who has been shaped and is by the American health care system and who currently shapes the American health care system. She's a remarkable person, a highly accomplished individual. And we're so delighted that she would take the time off of her busy schedule to be here with us, to share with us this afternoon and to moderate this discussion. She's an author, a speaker, a pediatrician, and a health policy expert who works to empower individuals to make better health care choices for themselves, their families, and their community. Her book, titled Reclaiming Our Health, A Guide to African American Wellness, was published by the Yale University Press. It is such an inspirational and practical guide that empowers our community to live a longer and a healthier life. And I'm speaking of Dr. Michelle A. Gourdine. Dr. Gourdine is CEO and founder of Michelle Gourdine Associates, an award-winning population health consulting firm that develops education and policy strategies to improve the health and well-being of women, people of color, and the underserved. Her company, Michelle Gourdine and Associates, is based on her belief in the right of all people to be healthy and is dedicated to creating a healthcare system in which all people benefit equally. She's a graduate of the Johns Hopkins University School of Medicine. She's a clinical assistant professor at the University of Maryland School of Medicine. She's a senior associate faculty member at Johns Hopkins Bloomberg School of Public Health. She's a former Deputy Secretary of Health for the state of Maryland, a former Health Commissioner for the Baltimore County, Maryland. She's a sought-after expert and speaker whose advice and books have been highlighted in national publications all across this nation. And she was a recent featured speaker at the 2014 Black Enterprise Women of Power Summit. She's high power. She's here today with us. Please welcome Dr. Michelle A. Gourdine, who's our moderator. Wow, that says so much. I can't wait.
Thank you so much.
Thank you.
Good afternoon, everybody. It's a pleasure to be here this afternoon, and I want to again thank Congressman Rush, Congressman Malone, our esteemed panelists, and all of you in the audience for being here today for this very, very important event and discussion. We look forward to hearing the wisdom of the panel. We also look forward to hearing the wisdom from those of you in the audience. It's my pleasure at this time to briefly introduce each of our panelists so that you may get to know them a bit better. And starting to my immediate right, our first panelist is Dr. Deidre Walton, who is the current president of the National Black Nurses Association, Incorporated, a nominee for the 100 Most Influential People in Healthcare 2014. She is an outstanding leader, one who is known for her acumen about health policy, human rights, healthcare reform, and negotiating change. She earned her BSN, MSN, and JD, and is a graduate of the U.S. Army Command and General Staff College. She has over 30 years of managed care experience in nursing practice, education, and administration. She has extensive experience in medical management for managed care organizations, where she develops, implements, supports, and promotes health services, strategies, tactics, policies, and programs that drive the delivery of quality health care. She's a retired commissioned officer for the United States Army, holding the rank of Lieutenant Colonel. Sitting right next to her is Ms. Teresa Lee. She is the Executive Director of the Alliance for Home Health Quality and Innovation, a 501c3 organization with a mission to lead and support research and education on the value home health care can offer to patients and the evolving healthcare system. Working with researchers, key experts, thought leaders, patients, and providers across the spectrum of care, the Alliance strives to foster solutions that will improve health care at home through quality and innovation. Teresa's work in leading the Alliance is informed by experience in Medicare reimbursement, policy, and law. She previously served as Senior Vice President at the Advanced Medical Technology Association and as Senior Counsel in the Office of the Inspector General at the U.S. Department of Health and Human Services. She is a graduate of the University of California, Berkeley, Harvard School of Public Health, and the George Washington University School of Law. Sitting to her right is Ms. Alethea Jackson, who is the Director of Federal Government Relations for Walgreen Company. Alethea manages Walgreens' policy and political agenda. In this position, she is responsible for developing strategies and programs to advance the company's outreach efforts and policy priorities. Prior to joining Walgreens, Alethea was Vice President of Federal Affairs at America's Health Insurance Plans. In that capacity, she provided substantive strategic and political counsel to health insurance companies and advocated on their behalf before Congress. Alethea is a native of New York and has a law degree from Syracuse University. She currently serves on several advisory councils and boards, including the Board of Women Under 40 Political Action Committee and the Advisory Council of Running Start Incorporated, a nonpartisan, nonprofit organization dedicated to inspiring young women to run for office. And finally, we have Mr. Srinu Santi, who is currently a healthcare policy advisor to Senator Richard J. Durbin of Illinois. Srinu attended the University of Wisconsin, where he received a BA, and received his JD at New York Law School. After law school, he worked as a policy advisor for Democratic Party congressional candidates. After that, he joined a nonprofit organization called the Center for America's Future, where he helped run a campaign finance reform project. Srinu subsequently joined Senator Harry Reid's leadership staff, where he worked on reauthorization of the Children's Health Insurance Program and ultimately the Affordable Care Act. This is where he cultivated an interest in and was taught health policy. Srinu left Senator Reid's office after almost 5 years of dedicated service to join the Center for American Progress. He then joined Senator Durbin's office almost 3 years ago. His responsibilities include Medicare, Medicaid, CHIP, Social Security, and disability rights. Would you all please join me in welcoming all of our panelists? We're going to start out by asking each panelist to deliver opening remarks, starting with Dr. Walt.
Good afternoon. I hope you can hear me clearly. I have laryngitis today, coming from Arizona.